name is Jane Beckett. I have a daughter who is 24 and she hasn't had insurance since she was 19. When she turned 19, she became uninsured. And even though she hasn't had major illnesses, the worry of wondering if she will have an accident or will have a major illness has been really terrible. She is a musician and a dog walker, and she works very hard, but she really earns very little money, and she needs to be in a big risk pool in order to have that kind of peace of mind in case she does have an accident or an illness.
My name is Laura Huth, and I am president and CEO of Do Good Consulting based in Urbana, Illinois. I remember when I was 22, after I got out of college, pursuing having to get health care on my own. And I remember making some phone calls to some health insurance companies to purchase what I needed to purchase. And that was the first reality check I had for how backwards this system was. I was asked, "Do you smoke?" And I said no. And they asked if I had any pre-existing conditions. And I said, yes, I have Crohn's disease. And I was immediately placed on hold. Came back 30 seconds later and they'd say, "I'm sorry, we can't help you." The fourth time this happened on the phone calls that day, I asked, if I smoked, would you still offer me health insurance? And I was told yes, but it would be more expensive. That doesn't make any sense to me at all.
Our country is finally moving towards a healthcare system where people are not left out in the cold because they have no money, or because they're the wrong age, or because they have a pre-existing condition, or because they change employment. There have been so many ways that people could be left out, and no matter how financially responsible they were, they could really be financially obliterated. This recent reform is moving us in the right direction.
The new healthcare legislation that's passed, I think, is going to go a long way in fixing some of these problems.
Young adult children can now stay on their parents' group health insurance policies until they're 26. So I'm so much in support of the Campaign for Better Healthcare and all of the work that they do to make sure that people can be covered by insurance even if they don't earn a lot of money, even if they're young.